excited to be here, so thank you so much for having me. I'm going to just enable the Q&A, which I'm not able to see yet, but I will make sure I can do that. And I'm going to go over some slides first, and then I'm going to really open it up. And luckily, a lot of people, when you registered, actually submitted some questions. So I have a host of questions already, and that is really great because there are already some really good ones. Jolie, I'm having trouble just pulling up the Q&A. So, but I'm going to go ahead and get started. I might have to unshare and share again, but that's okay. We'll go ahead and get started. So, in addition to how Jolie already introduced me, I run a selective mutism program. I am certified in PCAT-SM, and I'm on the board of directors for the Selective Mutism Association. So I wear a lot of hats and get really excited about doing some of this work. Okay, so let's talk. We're going to talk about a bunch of different things quickly, because this really isn't a webinar where I'm going to do a lot of talking from the slides. I really want to get to your questions. So let's just talk about what selective mutism is, because I think having a shared understanding is going to be really important. So selective mutism, first and foremost, is an anxiety disorder. So one of the things, and some of this actually speaks to the questions that have already been submitted, like what is selective mutism, or how can I educate myself more? Selective mutism is an anxiety disorder. So it falls in the category of anxiety disorder. We do classify presentations. It's not a perfect system, but we do it so that we have better information about symptoms and presentation. So it's an anxiety disorder where usually a child, because SM is typically diagnosed first in childhood, has difficulty speaking in situations where we expect speech. What does that mean? What it means is in a situation where speaking is expected, often school, extracurricular activities, play dates with family, extended family, there's a discrepancy between how much the child speaks when they are really pretty comfortable, and that's usually with family and at home, and when they're not as comfortable. So in places like school and some of these other places. It is not due, so we can't diagnose SM, just like we can't diagnose other things or other anxiety disorders or mood disorders, if it's better accounted for by something else. So if it's better accounted for by something else. So meaning, if it's better accounted for by a speech or language disorder or a discomfort with the actual spoken language, then we would not diagnose SM. Or if it's better accounted for by a different anxiety presentation, we wouldn't diagnose SM. We don't typically diagnose in the first month of school, because oftentimes kids can be a little bit more inhibited when they're getting comfortable in school. But the most important thing is that kids at home often are described by their family as a chatterbox, right? And that's very different than how they are when they're out in these other situations. Okay. This is really important here, which is answers the question that was asked, which is what causes selective mutism? And that was a really good question that was already submitted. The answer is a little bit unsatisfactory. So sometimes families will come to me and say, I really want to understand why my child has SM. And the answer, the reason why it's unsatisfactory is I can't say this is exactly why, this one reason or this one time point. Like other anxiety disorders and other mental health conditions, usually it is a result of a bit of biology or genetics. So sometimes you see in a family history, maybe not selective mutism, but maybe some anxiety somewhere and or mood difficulties, but really important. So that's what we call the nature piece, right? But the biology or the genetics. But the nurture piece is really important. I don't mean how well you nurture your child. I have no doubt that the caregivers that we see and are on this webinar are very nurturing. But what I mean is how the environment interacts with the child or tween or teen to really reinforce not talking. So negative reinforcement is a process that we'll talk about in a second, but it doesn't mean doing something bad. It just has to do with how we qualify what happens when we either remove a stimulus or not. So what this means is your child maybe is asked to say something like, sweetie, how old are you? And usually what happens is the child inhibits in some way. They turn away, they put their hair in their mouth, they look at the parent, they maybe whisper to the parent. And the environment, the person who asked the question likely sees that the child is uncomfortable and maybe removes the expectation to talk. Oh, you don't have to answer me, you're just shy. Or maybe they'll turn to the parent and say, oh, how old is he? And what usually happens is very well-intended caregivers and adults will remove the expectation to talk, because I can't see a show of hands, but I bet if I asked everybody to raise your hand, nobody wants to see a child in distress. It's very uncomfortable for the child, and adults don't like to do that, put them in discomfort, like in an uncomfortable situation. So we remove the expectation to talk. Oh, she's 5. Oh, she's 18. She's 12. And what happens is everybody feels relief. The child feels relief, but so do the other adults. And that's the process of negative reinforcement, which actually makes it much more likely that that situation will happen again. If we have some time, we'll do some math to see how much we get practice not answering questions. Okay. So when we think about treatment, it's probably pretty confusing to think about how do you treat a child or teenager with selective mutism. So what we know is that there's an evidence base more broadly, there's an evidence base for behavioral and cognitive behavioral therapy for anxiety disorders. There's a pretty robust literature on that. When we look at selective mutism, the research is a little bit less, but there are some larger scale studies that look specifically at some specific types of behavioral or cognitive behavioral therapy. And so we know that the evidence lies with that kind of treatment for selective mutism. Essentially, and this is me paraphrasing, this is not coming from a specific research study, treatment that focuses on helping a child talk more in situations where talking is expected in a gradual way. So that might be gradual exposure. Things like fade-ins would fit under this category. Oftentimes treatments like the one that I use, PCITSM, involves training caregivers or other adults who are closely connected to the child to use specific skills to help build speech. So things like supportive therapy or play therapy, while those things can be really nice and they can feel good, a treatment that doesn't focus on generalizing speech, increasing speech, doesn't always result in more speech. Fade-ins we can talk about a little bit more, but essentially that's the process of transferring speech from one person to another. And when we think about who we transfer speech to, often I think about the person the child already talks to, often a caregiver, or me as a therapist or a teacher from last year, to a new person. And then again, treatment that talks about generalization. So I went to a school today to work with a student, and it was about generalizing. The child already talks to me, but my goal was to help them speak first in front of other people and then to other people. That's the example of generalizing speech outside of just me and the child. A big question that often gets asked is, does my child need to see an expert in SM? And I'm going to stop sharing for a second just so I can open the Q&A. Perfect. And then see if I go back to my slides, if the Q&A will stay up. And it didn't, but that's okay. I'll go back and forth as soon as I'm done with my slides. The answer is, while we would like a child or a tween or a teen to see someone who really knows their stuff in SM, because actually if you don't know your stuff, you can sometimes waste a lot of time in treatment. It's hard to find experts in this. So what I will tell families is to be savvy consumers and ask the right questions, like, have you treated selective mutism before? And if so, how often? And what kinds of strategies do you use? But I've often worked with or collaborated with other providers who aren't experts in SM, but they're experts in other anxiety disorders, or they know a lot about cognitive behavioral therapy or behavior therapy. Okay, I'm going to give you some quick tips and strategies because I really do want to open this up to questions. If you suspect selective mutism, seek out an evaluation. And I mean that in not a tongue-in-cheek, because that seems obvious, but sometimes this means, and I'm not going to ask people to raise their hand, but I've worked with people before who've actually tried to do that. They go to their pediatrician, and the pediatrician maybe is very well intended and says, oh, it's a boy, he'll talk when he's ready. Boys talk later than girls. And, or, oh, I'm not so worried, talk to me in a year or two. And what I would tell you is to trust your gut. And if you have a sense that your child really isn't speaking, um, if you really want to, like, you might need to pursue it. And the way you can do that is actually, I have some resources at the end. The Selective Mutism Association does have a find a treating professional feature that can sometimes be super helpful. If people reach out to me, I'm happy to try to direct you to places where there are folks who do this evaluation. And so you want to have it done by a mental health professional. So psychologists, social workers, mental health counselors who work with anxiety, children specifically. It could be a speech language pathologist, especially if they've worked with children with SM before. You want to seek reputable sources to learn more. There's nothing worse than Googling something and just Googling a search term and then getting down a rabbit hole. And so I find that it can be really frustrating and stressful to know where to look. So ADAA, this is the organization you're on right now. ADAA is a great place for resources. The Selective Mutism Association, the American Academy of Pediatrics, right? So you want to see what your resources are so that you're not just Googling things. Googling things can be a good start, but it often can take you down a rabbit hole. Again, we already talked about knowledgeable provider. Talking to school can be really important because your child is likely at school or daycare or in a school setting most of the day. And if that's the case, this is a huge way that you will know if your child is exhibiting some symptoms, because your child at home likely is speaking to you no problem. They might even come home and sing all the songs that they sang at school, and you might think they're talking there. So getting information from school and then collaborating either to have a 504, sometimes an IEP, or even just an informal conversation, really important. I want to give you 2 helpful skills to use today. So let's say your child has a diagnosis of SM or you suspect they have SM. None of these skills are going to be harmful at all. They're going to be helpful to all kids, so they're not harmful at all to use. When we think about warm up, we think about the time when we're not yet asking questions. So if your child was walking into a birthday party or a room full of people at a family gathering, bombarding them with questions would likely be not such a great idea. That's likely going to have them retreat a little more. So what I say in those moments would be make comments and describe what they're doing rather than ask them questions. So it might sound like, Jolie, I see you putting your backpack over by where I put my purse. Thanks for doing that. That was a really good idea. Or you might say, I see a lot of toys over there. We can play with some of those toys if you like. So you're making some comments about what you see. You can describe what your child's doing. If your child is talking to you during warm-up time, you can say things like, thanks for telling me, or I love that you're answering me at this new person's house. So those are 2 skills that we might use when we're warming up and not asking any questions. When you are asking questions, a really helpful tip, and again, these are just some very quick tips, I have resources for you in a moment, is asking forced choice questions over yes/no questions. Yes/no questions often get this. Rachel, do you like chocolate ice cream? Now that was communicating, I think all of us, no matter if we're from a different country, in the state, the South, the West, the North, this means yes. So rather than do that, saying, do you like chocolate ice cream, vanilla ice cream, or something else the best? Those types of questions often get a better chance at a verbal response. And then when we have speech in response, so like today I went to a school and I asked the child, do you want to keep doing this activity? Or I didn't say this activity because they were young. Do you want to keep coloring or do you want to do magnetiles? And she answered and said, keep doing this. I said, thanks for telling me. Or I even said, thanks for telling us, because we were sitting next to the teacher. So we want to reinforce speech by using really specific praise. Thanks for telling me. Maybe repeating what the child said. Oh, magnetiles. And we might even want to use a check mark if we're tracking speech with some sort of chart. Okay. A bunch of resources. And again, Jolie already said that she's going to share these slides. And so you will have them after the fact. But here are a bunch of resources, all within the Selective Mutism Association, which is why it's highlighted in yellow. So the website is selectivemutism.org. There is actually a PDF for educators. We've done the work for you. It's not perfect. It's not individualized to your child, but it has a lot of really helpful resources for teachers. We also have an educator's web course that we've put together. That costs money. It's not free. However, because it has multiple hours of video resources for educators. So it talks about how to do a fade in and how to advocate for a 504 in elementary school versus middle school. Also, YouTube is for other things other than just watching videos of kids playing video games. Selective Mutism Association has a channel, and in that channel are tons of videos about bilingualism in SM and school advocacy and some of these PCIT-SM skills I talked about, and a lot of other categories. So I encourage you to go there to see some of these free resources. And then if you're in the Chicago area, we have a conference coming up in October, and there's a virtual option for limited content. Additionally, Anxiety Canada has a great website with lots of really amazing resources, videos, tips, tools for SM, but also other anxiety disorders. Love ADAA.org, love it. And then the SM Learning University is a web course that Steve Kurtz put together. Here are two other resources. So I wrote a book, and there's a coupon code there if you go to the publisher. This is more of a step-by-step guide for children and their caregivers. It's more workbook-like. The book on the left by Amy Cordoba and Sherry Saffer, she's a parent, and Amy runs Thriving Minds. This is an amazing field guide for parents, but also I find it great for schools. So just two resources that might be of interest to you. And then I'm actually going to stop sharing. I'll pop my email in the chat so that people could reach out to me. Some people don't always like to ask a question in the chat or in the Q&A. And so I'm going to open the Q&A so I can start to see questions. Okay, so there are a lot of really good questions. So one question that is being asked is about funding for therapy. This is a really tricky question because a lot of times, some of you may be aware that there are sometimes providers who have very specialized knowledge base and are fee for service. What I would tell you is that, yes, a lot of places will offer reduced fee in different ways. So off the top of my head, I don't know all of the places, but for example, a place I used to work, the Child Mind Institute, and I used to run their program. They have a very robust financial aid program. And so I encourage families when they reach out to a provider to ask about financial aid options. So sometimes there are options like that, like scholarships. There are other programs. I know Thriving Minds offers one scholarship to a camp. Sometimes places like FIU in Florida, they do research. So they often are offering people free treatment for being in research studies. So I think you want to look and ask. Additionally, sometimes you can go through your insurance to ask for either a single case agreement or a gap exception. I've written a lot of clinical letters making a case for medical necessity. So what I will tell you is it's not easy to navigate insurance companies. No offense to insurance companies, but it can be quite challenging to navigate that system. But yes, there sometimes can be ways to offset the costs. I've often also seen other ways as well. So that was a really good question. Another question. So a question asked, how does selective mutism affect students in adulthood? So I think what I mentioned was that this is typically a presentation, not my presentation, but SM is usually first picked up on in school. And the reason for that is because a lot of times kids start to go to some level of school, whether it's daycare or preschool, and someone will usually, this is a very typical story I hear. A parent will reach out to me and say, I think we need to make an evaluation with you because my child, I'll use the name Jackson because that's my son's name. So it's not me breaking HIPAA because he's just my kid. Jackson's not talking at all in school. Does he know how to speak? And the parent will go, I'm really shocked because my child is a chatterbox at home. And Jackson comes home and does all the hand movements and gestures to all the songs. And he knows, he knows everything. He told me about all his friends. And so this is often a time that this comes up, right? And it's not surprising for that to present in the younger years. For sure, SM could persist into adulthood in a variety of ways. One might be maybe a child has really never gotten treatment. There are some kids that actually can get by fairly, not easily, but let's say a child gives thumbs up, writes very easily, nods and gestures. I've seen kids come to me for treatment at 12 or 13 and they've done pretty well in school, communicate maybe to or through a few friends. So it's possible that someone could get to adulthood and not have received any treatment. I haven't typically, and it doesn't mean this doesn't exist, but I haven't yet worked with someone where they talked absolutely fine as a child, chatted at school with friends, with extended family, and then all of a sudden developed selective mutism as an adult. Although social anxiety disorder, very similar overlap to some of those symptoms. So social anxiety disorder is an anxiety disorder where the person fears embarrassment or criticism or negative evaluation in a speaking situation, but could be writing, could be eating in front of other people, could be drawing. So the answer is yes. I think the difference, one big difference is when you're a little older, you have the ability to think about your own thinking process and have an ability to reflect on your own experiences, which is really hard for a 4 or 5 or even 6-year-old. And so this is why sometimes you'll hear that CBT or cognitive behavioral therapy is really for kids who are like 8 and older, because people who are 15 or 18 or 25 are able to likely, even if they can't speak about it yet, are able to reflect on, how do I think and feel about this? What situation is harder for me to engage in? Okay. So there's another question, which is, does something like joining an activity like Toastmasters help? Let's say this person said they grew up in an environment where maybe treatment or expensive treatment might not be available. And would joining an activity where there's talking involved, would that help? I love that idea. If you think of what do we want to provide for people who have difficulty doing something. So let's take talking off the table. And I'm going to put it on everybody to participate. Let's say I tell you that I have a 10-year-old who's really afraid of dogs, and they avoid dogs like nobody's business. They don't look at TV shows with dogs. You can't even say dog, cartoons, stuffed animals. And now they have a new neighbor, and now they're their best friend because they really like this kid. Problem, they have a dog. And they come to you and they're like, I need some help getting over this fear. I'm curious what someone might say they think is going to be something the person might need to do to get over that fear. And you can pop it in the chat if you want. Graded exposure can help. Love it. Yeah. So graded exposure, love that. If I said, I think a great idea would be go to that next door neighbor's house, get their huge St. Bernard, bring them over to the original kid's house and plop that St. Bernard in their lap, that would probably be a bad idea. We call that flooding, right? So in order to do treatment or to face fears, we do things called exposure. And we want to have opportunities to face situations. Someone said, do small expectations first. So we actually want to give people practice and repeated practice doing the opposite of avoidance, the opposite of going around that circle of negative reinforcement. We actually want to give people practice doing the hard thing, but in a very small step first. So it might actually involve just starting to say the word dog, right? Why? To give the person, the child, but also the adults around the child, an opportunity to see, yeah, this is hard. This is uncomfortable. This has been avoided. And it's possible to tolerate it and then go to the next step. So my reason for saying this was just to say that a big piece of what we do is to do exposures. Okay, I want to go to another question. Oh, and so to go back to Toastmasters, sorry, I lost my thread there, would be if the idea of going to Toastmasters is to join an activity where there will be speaking and there will be mingling and there will be participating in some way, I think that's a great idea, a really great idea. And I would want to encourage that person to set some really reasonable goals. So I don't know Toastmasters too much, but if there's, let's say, a speaking expectation, if a person has really never spoken in a group, it might be a very big, it will might be a very big goal to say, I'm going to go and I'm going to speak in front of everybody. And I wouldn't want someone to be disappointed with themselves if they weren't able to do that. So in that situation, you might go back to what someone else said in a really in one of the slide, the person said, I wouldn't do the abrupt thing, small expectations first. Maybe the first would be just to go to that Toastmasters event. Maybe it would be to plan to say one thing in response to someone's question. Even a planned answer. Like if someone says, where are you from? I will have practiced saying, I live not far from here, or something along those lines. So we really like the idea of doing things in a stepwise way. Okay. Love all these questions. I'm going to take a look. Okay. So a big question that comes up is when we talk about teenagers. And sometimes, like in this particular question, I see that we have a kid who's had treatment as a child, has had treatment maybe at a center, has done some intensive intervention, has had medication and is doing exposures, but still really struggles to speak with peers, right? And so these are oftentimes there is one thing that can still be quite hard, right? And maybe it's talk to peers. It could be for another child, it might be something very different. It might be they can talk to peers all day long, but they can't really talk to teachers, right? I think, and again, there are a lot of questions here, so I'm going to try to offer some recommendations and know that we could have, further conversation if we have time. But knowing that like one of the things around expectations is to set the appropriate expectations. So if the goal is to have free flowing conversations with peers, like for example, in a back and forth fashion, that actually takes not only ability to get over the anxiety of that, but it also takes some skill. And I often like social skills, the ability to kind of keep up with a quick conversation, insert yourself in and say like, oh, me too, or not me too, right? So that moves very quickly. And the fluidity of it is something that not only takes the ability to tolerate the anxiety, but takes skill. And I often find that teenagers who've had SM for a long time have missed opportunities to practice those skills. So I do think that let's say in school, if they're working with a speech language pathologist or a school counselor, having those opportunities to have conversations with peers, but in what is going to feel like a more contrived environment where it's, let's say, being facilitated by someone else. And that can feel like, well, my child's not doing it themselves, but they're going to need to start somewhere. So like we have a group with some teens and tweens where we will say the child might make a goal for that day to keep a conversation going. And my idea of progress might be if they actually make a comment. My expectation that they keep it going back and forth might be too high and might need a ton of repetition. So I just think that that's something to keep in mind. Okay. So this is a great question. My daughter's 14 and hasn't spoken to anyone outside of our nuclear family for a long time. So the question is, should we focus on one particular person and that's as a breakthrough, or keep a broader approach? I wish I had the absolute right answer for this. I think it's tricky. I think my gut tells me that I would want to take an approach where you utilize skills across some situations and then maybe focus on a fade in with one person. But I think if you only focus your attention on one person that a child's had 10 years of not talking to, I said I was going to do some math. So let me pull the math. 365 days. Oh, that should have been easy for me because that's a lot of 365 times 10 is 3,650 repetitions of not talking to someone just by a day. So meaning I wouldn't want to put all my eggs in one person basket and only do that. I think I would want as a parent to learn, how can I help my child talk to me first, our nuclear family, in lots of different places? That's often something people don't think about. That before a child can, let's say, talk to anybody, a person at a bakery counter, a teacher, a coach, they often need to be talking to the person they already talk to in a lot of places. And maybe that happens. So maybe this person has their 14-year-old and they go to Starbucks and the parent says to this 14-year-old, did you want to get hot chocolate or do you want something cold? And the child says to them, like, hot. We don't often think to say, like, great answering me at Starbucks, or I love that you're answering me as we get closer to the counter, right? And that, to me, as we get closer and are prompting the teen or child to answer us in front of other people, is often the precursor to talking directly to them. So I think I'd want to have that broad approach while also maybe engaging the 14-year-old in, I know that it's been hard to talk to these people. We can start with this person, or that person. Go ahead and choose who we'll have over for some get-togethers. Okay, I'm going to look at, okay, so I'm going to look at our Q&A here. So this is also a really good question because this is someone who works in a school, right? So the question is, I'm working in a school with a student who's really struggling and I'd like to support the parent better. The student has a diagnosis, but I worry not enough or correctly is being done as far as outside therapy. And so what I will say is, yes, we could probably spend the whole hour just talking about school. And what I will say is a couple things is, if as an educator, and I'm not sure if it's a teacher or an interventionist, if you are noticing SM and you're wondering, is enough happening out of the home, you may be able to find out that answer, right? So you may be in a position of being able to engage the family and have just an honest conversation with them. Like, this is what I'm noticing about Rachel in the classroom. Is this something you're familiar with or not familiar with? Is this new information to you? Are you working with anybody? Let's just make the assumption that they're not. And you are like, okay, now what can I do? Getting the educator web course or investing in some resources on our YouTube channel for Selective Mutism Association and starting to maybe use some of the strategies may in fact be quite helpful in the school environment, which is often a place where kids struggle. The ideal situation would be to have collaboration and everybody's on the same page, let's say with a 504 or an IEP that's needed. And in an ideal world, the child might be getting outside therapy with a provider with an expertise in SM, and the school was doing all the things to promote speech. And let's just be honest, that just doesn't always happen. So I would say that sometimes a teacher or an interventionist at school is in a great position to help increase speech in just small ways. And so what I will say is, if the child is talking even a little teeny bit at school, and there is a webinar that I did with a colleague of mine who's a speech language pathologist, it's called Differentiating Exposures at School, and it's on the YouTube channel. And it actually talks about what to do specifically if the child isn't talking at all versus talking a little bit. So because I won't be able to give that whole talk right now. But if the child is talking even a little bit at school, you can use some strategies like looking for opportunities to walk over to that child's desk, use those warm-up skills, make some comments. This morning, it was actually pretty chilly out. I had to put a sweater on because it was really pretty cold. Do you really like it when it gets cold out or not so much? So maybe you make some comments. The child has spoken before and you look for opportunities to give them chances to practice talking more. That's going to be different than if the child has never talked in the school environment. Sometimes if the child has not ever spoken in the school environment, you will need a fade in order to establish or pass the talking baton. But there are probably a lot, we have over 100 people on this call. And my guess is there are some folks that have children that are speaking a teeny bit at school. And if that was the case, getting some more practice can be really, really, really helpful. Okay, I'm looking at some more questions. I think there's some really good questions. Okay. Awesome. I love all these questions here. Okay. So when working with an older teen with social anxiety, but also has a history of SM in preschool that was untreated, do you have to circle back to address the SM as part of the treatment? Well, this is an incredibly sophisticated question. And my answer is, I think it depends. If I work with plenty of teenagers who have social anxiety, and I might not ever have known that they had selective mutism unless they or their caregiver told me. So the answer is it's important to have context and a good developmental history so we really have a whole picture of the teenager. If, however, the teenager speaks and speaks to me and speaks at school, and it seems like the impairment is more around fear of what other people think about them and specific social situations where speaking is expected, but maybe other types of participation, like doing gym class or doing things in front of other people, asserting an opinion, making small talk, drawing, then I might not need to totally go back and address the SM, so to speak. And the cool thing is that a lot of strategies, so the strategies I use with teenagers and SM are the same strategies I use with younger kids, just with obviously a caveat. For teenagers, I certainly don't say, thanks for telling me, great telling me the answer. Most teenagers would be pretty frustrated if I use that type of tone of voice. So we don't do that at all. We really want to treat a teenager with respect and with a rapport that understands, like, I get how old you are and where you are in your sophistication. Additionally, with a teenager, you have the ability to talk about their experiences, right? Even if they can't fully talk about it. So it might sound like, Jolie, I was learning that like when you were younger, it was really hard if a teacher called on you and you almost felt frozen, or maybe frozen's not the right word. You can tell me if you want how it felt. And I wonder, like, does that still happen? Or is it more, and then I might say the different situations that are the current problem, like asserting an opinion or only talking to like authority figures, right? So I think it would depend. I think we want to take it as this is the whole picture. And because some of the strategies are going to be very similar, gradual exposure, reinforcement for approaching situations, right? Making a fear hierarchy, there's probably going to be a fair amount of overlap. Really great questions. Okay. When SM occurs with school refusal, which would you recommend treating first? Now, this is also a really complicated question, and I have a couple families where I'm working with students with this presentation, and maybe not only school refusal, but school refusal, depression, social anxiety, and SM. I think any of us, and you can give an emoji if you want to, if I asked you to work on your talking and you're getting comfort with large groups and you're getting into new situations, you might say like, hey, lady, that's a lot of things you're asking me to do right now. Like, how are you expecting me to work on all of these things? Like, whatever happened to one thing at a time? So what I will find is I think I'd need to understand more about the selective mutism and the school refusal. The answer is we have to work on all of it. And at the same time, a lot of times, if we could get the child into school and we could get the child comfortable with someone, even if they're not yet talking, right? So it might sound like the child gets into school and the teacher or the school psychologist is like, Rachel, it's so good to see you. I know it's hard to come in the morning and we have such great stuff planned for today. This is what we're going to be doing. And they're not asking questions. There actually isn't yet an expectation to talk, but there's just an expectation to come to school. Then I would say we might build attendance, even in a modified way, 1 hour at a time, half day at a time, and really just work on engagement, like doing activities. Like this child today is going to work on one worksheet, or this teenager is going to go to each of their classes just for X amount of minutes, and then I'll start the talking practice. So I think that could for sure happen where we might work on one specific thing first. And there are other situations where we might be working on both, but I think we want to think about where the level of impairment is and what the priority order is. Okay. Okay. Great question about from someone who's working with some young adults who have SM, they don't speak at all outside the home, and also have a co-occurring presentation of autism. And so they're able to engage with the tutor and other tutors. They have not received therapy, right? You work to reduce anxiety and acclimate them outside of the home. Here is the tip of the day, I think, to take nods and gestures without reinforcement. Okay. There is a difference between if I said to Jolie, who's my ADAA helper, do you want to go to Starbucks after we do work? And she gave me a thumbs up and I said, oh, great idea. Then I have negatively reinforced gestures, right? I asked her a question. She gave me a thumbs up and I almost like acted like it was talking. Okay. So hopefully this is going to help Anna who's asked this question. However, if I'm pretty sure that Jolie is not going to be able to answer that, but I want her to give me a thumbs up or thumbs down, I could do this. Jolie, you're working really hard today. And I was thinking that after we do X, we could go to Starbucks. Give me a thumbs up if you'd like to do that. I said, give me a thumbs up if. I didn't say, do you want to do that? And she gave me a thumbs up. So the answer to this is, think about what you're asking or prompting for. If you don't want to ask a question and then get a gesture and be stuck, then don't ask a question. If you're thirsty, point to your water bottle. If you want to read a book, show me the book you want. I heard you have some pictures of your dog. Show me them on your phone. So hopefully that, because this is very, really important actually. If you don't ask a question, then it didn't go unanswered. So the child I went today to school answers when I am there and doesn't yet answer when I'm not. So I would want the teacher not to then say, do you want to finish your picture from this morning? We would want the teacher to say, go ahead and get your picture from this morning and you can finish it. Okay. Just as a reminder, people are asking for the resources and the link, and you will get those after. Okay. There is a very good question here about what the fade-in process. So I am going to talk about that. And then I will talk about rewards. So the fade-in process is the transfer of speech from one person to another. What it essentially means is that first, the child or the teen is talking to the person they already talked to. So let's say we're doing a fade-in at school. It would be not reasonable to have the parent come to the school, sit at a table, and the teacher comes right over to join them. Because that to me is not gradual, right? So the first step in a fade-in is that the parent, I'm saying parent because that's often who it is, but it's the person the child already talks to or the teen already talks to, and that person is able to get the child or teen talking in the new environment and a new situation. And then slowly and gradually, the new conversational partner comes closer and joins that process, that interaction. So it might be that I have my child in a room and they're talking to me and I say, Ms. Smith, we're ready for you to actually come and sit at this table over there, but we're not yet ready for you to come in to our game. So now maybe the teacher comes to a table adjacent to where we're sitting, and then I would engage my child in the game that we were playing. Now, let's say we're playing a card game, great. And I say, oh, do they both have the same hat or they have a different hat? Now, maybe my child now starts to whisper. Actually, don't care if they're whispering at that point. If they're answering me saying, different hat. Oh, they have a different hat. Thanks for telling me with Ms. Smith at the table. So the idea is, if the child continues to answer the old person, then we can move that new person closer. We cannot rush this process at all. It may be that now the teacher joins and we're able to then say, I might say, Ms. Smith, go ahead and ask Jackson if they have the same hat or they have the same shoes. And the teacher says, Jackson, do they have the same hat or the same shoes? And the child answers, but looks at the parent. Again, all successful. That would be a success because it's moving closer and closer to answering that teacher. Now, part of a fade in is a fade out. We can't just assume that the child answers the teacher with the parent there, and then like 2 hours later, the child's going to start talking to the teacher. Often it actually takes quite a bit of repetition, but that is essentially what a fade in is. There was also a question about reinforcement or rewards or prizes. I have never had a child ever, and I've been doing this for a long time, become dependent on rewards or prizes. Never. Oftentimes they forget about some of the checks and rewards over time. Now, one of the questions was, and I don't consider it bribery either. Bribery is something you do in the moment as an act of desperation. If you do this, I'll give you this. Versus every time I hear you answering my question at school, I'm going to go ahead and give you a check mark. And when you get 10 checks, you're going to earn a gem or a coin or a small trinket. If you have a child that says, like, I'll only do this if you this, like, I'll only do this if I get a prize, then I think there's room to have an out of a moment conversation about that's not actually how things work. We don't get prizes for everything, right? We also would say, like, I understand why you would want a prize. Prizes are really cool and rewards are really cool. And these are the things that we use rewards and reinforcement for. So I have no concern about using rewards and reinforcement. We do want to make sure that the rewards and reinforcements are meaningful to the child. So actually today I had a great session with the kid I worked with, and I told her that she could come and pick her prizes. And she actually told me she didn't want any prizes today. And my answer was, thanks for telling me. If you change your mind, I'll have them when I see you next. And we called it a day. I could get kind of deep into why she didn't want them. Maybe she didn't want more attention. Maybe she just didn't feel like it. But she did all the things I needed her to do that day. There's a great question here about, should a child go to extracurricular activities even if the support isn't available and they may not talk there? My answer would be yes. I think that there is often, we have to think about the fact that functioning happens in a lot of different places, meaning there's going to activities, there's physically participating in activities, which a lot of kids with SM struggle with. There's the talking to the adults, there's the talking to peers. So let's say your child wants to do gymnastics and you're pretty sure they're not yet going to talk there, but you would be super happy if they went and if they physically participated. I would say totally let them go. The truth is they will get negative reinforcement for not talking because we can't control all people. In an ideal world, I would actually want to have a conversation with the gymnastics coach and say, look, Susie is super excited about gymnastics. She is still working on talking to people in situations like classes. Here's just a tip or strategy. Instead of asking questions for now, it would be great if you could just tell her what you'd like her to do or give her information. Like, it's time to go jump on the trampoline, go ahead and jump, or show me where you want to go. But I think it's important for kids to do those kinds of activities. Okay. There's also a question here, how do we help our child if there's no particular pattern? So sometimes there's a pattern and sometimes there isn't. Like a child might order all the time for themselves, or they might not if it's in a specific kind of place, like at a counter versus a table. And this person is saying that there isn't a particular pattern and how should you address it? Sometimes I would like some more information and investigate if there's anything else going on in terms of making rules or rigidities around speaking. But I would say when you as the adult have some really good strategies of what to do in every situation, then you will stay calm in those situations. So I sort of take it as like every day is going to be a day. So if ordering goes well and it goes like that for days, and then that one particular time she can't order, then I'm going to go to my place of last success in a really calm way. I'm not saying this parent or adult does this, but I'm not going to be like, Jolie, you could order yesterday. Why can't you order today? I would just say, adult, what do I need to do? I've told them it's your turn. Go ahead and order. And they don't do anything. I might say, okay, I wonder if they were asked a forced choice question, if they could order. So I might say to the waiter, we're working on answering questions. Please ask my child if she wants a hamburger or a cheeseburger. Maybe that would be enough for the child to answer the question. Maybe it's not. Then I might take the ordering off the table and just say, wait, did you want a chicken nuggets or pasta? And then if the child was completely frozen, I might actually say to the waiter, we actually need a couple more minutes. Could you leave and come back? And so I actually will just treat it as, I guess this is something that just needs practice. And I'm going to make it just a slight bit easier. And I'm going to try to end on some level of success. Okay, let's see.
Dr. Bestman, I think we have time for maybe 2 more
Perfect.
questions. Yeah.
Yep. Okay. So tips for elementary age kids. For example, other children think my child is rude or ignorant. This has led to incidents of bullying, especially on a bus. Yes, for sure. This is both very upsetting and happens, right? So I think a couple things. When it's happening in a classroom, and sometimes it's not to the level of bullying, but it might just even be like, Susie doesn't talk, she likes chocolate, right? Or she doesn't do this, she likes this. So I think education to a teacher when there are adults around to be able to say something like, actually, she does talk, she's working on answering, and and then the teacher could either ask the child or not. If it is on the bus, I will say that, so sometimes reading a book to the class can be helpful when they're young kids, just about what SM is, and sometimes it's not all that helpful. I think if there are instances of bullying, that is very different than kids being kids and saying like, why don't you talk? Or she doesn't talk, she likes chocolate. I think things like the bus, while there aren't typically adults on the bus, if your child is being bullied or targeted in some way that's leading to high level of distress or they're getting hurt, actually that does need to be escalated to, for example, the principal, and maybe they do need to put someone on the bus, or maybe the kids on the bus need to be spoken to, which sometimes can help. And obviously, depending on the age of the kid, sometimes doesn't. I just saw this in a chat group recently about like looking at video footage on the bus or actually putting a bus monitor on the bus. So sometimes we do need to escalate it in terms of where we give the information. Okay. Question about like, could an ABA be trained as a shadow? Yes. Those who are familiar with ABA might say, hey, this PCITSM stuff, this like reinforcing speech or even sometimes sounds before speech seems a little ABA-like. And it is, it's not ABA, but I have worked with some ABA therapists who say, hey, a lot of this stuff makes a lot of sense to me. So I like all kinds of different disciplines being trained as shadows or supports. The most important part is that the person understands what SM is, understands sort of the functions of behavior like avoidance due to anxiety, not because of defiance or willfulness or stubbornness, and then how to set up situations to reinforce engagement and things like that. Okay, Jolie, that was 2 questions, so I'm going to turn it back over to you.
Many thanks to Dr. Rachel Bestman for sharing helpful information about selective mutism and answering questions from our attendees during the live presentation.